Hi, today we're going to be talking about community opioid overdose training. The goal of it is preventing opioid overdose. So we're going to talk about the prevention, we're going to talk about the recognition, and at the same time we're going to talk about our response. The initial focus was on training police officers. Today there are approximately 1,000 naloxone trained police officers in Westchester County, and this is we're talking about in 2014. So now at least it's triple or quadruple that number. Since the training began in the late 2014, lives has been saved by a lot of police officers from the following police department: Croton, White Plains, Lewisboro, Mamaroneck, Mount Pleasant, Chappaqua, Peekskill, North Salem, Buchanan, Yonkers, and Westchester County, and. In the 2015, the health department expanded that program to include the public in order to increase the potential to save lives. We are getting Good Samaritan that we are equipping, training, and we are putting them everywhere. To date, over 2,700 members of the community have took training in naloxone, and some of them already had administered it. So we are requiring diverse and robust collaboration among law enforcement, public health, mental health community, medical professional, and community partners. So we are all coming together to fight this epidemic. Today's training objective is for you to recognize the signs and symptoms of overdose. Know the steps to take when encountering an opioid overdose. Know how to properly administer Narcan. Report the use of naloxone. Understand naloxone co-payment assistance program by NCAP. Be aware of CDC guidelines for prescribing. Some facts: opioids, including prescription and illicit, killed more than 33,000 people in 2014. Incredibly, more than any other year on record. 91 Americans die every day from an opioid overdose. In New York State, the opioid overdose rate increased 20.4% from 2014 to 2015. Nearly 50% of all opioid overdose deaths in the U.S. involve a prescription opioid. The number of overdose deaths involving opioid have quadrupled since 1999. What are opioids? What is common opioids? Codeine. Okay, codeine is only available in generic form. Fentanyl. Okay, hydrocodone. Hydrocodone with acetaminophen, like Norco, Vicodin. Hydromorphine, like Exaloca. Methadone, morphine. Oxidone, like Oxycontin. There's so many of them out there. Now, heroin. Heroin can be injected, smoked, inhaled by snorting or by sniffing. Associated with serious health conditions: collapsed vein, infection of the heart lining and valves, contraction of infection diseases like hepatitis and HIV, because these sometimes are you're using needles. Fentanyl, the most powerful opioid used in human medicine, often used during surgery and to treat cancer pain. Similar to morphine but 50 to 100 times more potent. Began to appear in large quantity as illegally manufactured fentanyl. IMF about 2013 has rapid onset with a short duration, often mixed with heroin or sold as heroin. Overdose can be reversed with naloxone, may require multi-doses. Chest wall rigidity: cannot move chest wall to breathe even with mighty being consistent trying to do so. Half-life equal 3.7 hours. Opioid overdose prevention efforts. We have something we call iStop, increased access of naloxone, the NCAP program, the safe medication disposal. Effective July 2016, lowers prescription limit for opioid for acute pain from 30 to 7-day supply on initial visit to doctor, with exception for chronic pain and other condition. Increase access to addiction treatment by eliminating insurance barriers. Requires ongoing education on addiction and pain management for all physician and prescriptions. Naloxone available at pharmacies now. The Harm Reduction Coalition issues standing medical orders to pharmacies. Every person dispensed naloxone should have training and opioid overdose recognition and response. Pharmacist needs training to be better prepared to answer questions when dispensing. The cost of RX is approximately $145. The NCAP, no cost and lower cost naloxone is available at pharmacy across New York State. Up to $40 in co-payment assistance is available. To find the nearest registered pharmacy, visit health.newyork.gov. Risk factor for opioid overdose. Loss of tolerance, mixing drugs, synthetic drugs, using alone, risk for fatal overdose, drug strength, purity, and depression. What is the signs and symptom of an opioid overdose? Unresponsive or minimal responsive, not breathing or respiratory arrest, slow breathing 10 less than 10 per minute, snoring with gurgling, blue or Haken color cyanosis. What is naloxone? Naloxone is a life-saving drug that can revive overdose victims. Narcan is the brand name for the drug naloxone. Naloxone or Narcan helps restore breathing to a person who's overdosing from opioid drugs such as heroin and prescription drugs. Let's see naloxone in action. Wakes the person who's overdosing in 2 to 5 minutes. Works for approximately 30 to 90 minutes. So that person needs to go to the hospital because he could go back into that. Reverse opioid effects causes sudden withdrawal, unpleasant feeling. Person may become aggressive, not addictive, safe, highly effective. What happened during an opioid overdose? Carbon dioxide levels increases, oxygen level decreases. Process takes time. There is time to respond, but no time to waste. So opioid actually repress the urge to breathe. Okay, how we gonna do about responding to an overdose? Step one. First one, you're gonna stir her up. If the person is passed out and appears to be overdosing, shake them and shout at them to wake them up. If no response, grind your knuckles and their chest bones, stir her up 5 to 10 times. If the person does not respond, administer naloxone and call 911. If you need to leave to call 911 or to get naloxone, leave the person in the rescue position, okay, lying on their side with their top arm and leg cross over their body. This lowers the chance they will choke and their own vomit. Call 911 right away. Tell the 911 dispatcher, I think someone has overdosed. Tell the dispatcher you are going to administer naloxone. Give the address and location. Stay with the person until help arrives. Resuscitation. Naloxone is not a substitute for CPR. If the person does not appear to be breathing or is gasping, they need CPR. Naloxone now they come in three ways. We come the nasal, which is the, and we have also the the Narcan that we are putting the kit together, and we have the Narcan within a syringe. They all has different way to administer them. Today we are going to be talking about the nasal spray. Okay, the adapt Narcan device. Okay, all right. I want to make sure that we all Okay, peel back the package. To remove the device, hold the device with your thumb on the bottom of the plunger and two fingers on the nozzle. Do not press the plunger. Place and hold the tip of the nozzle in the nostril until your fingers touch the bottom of the person's nose. Press once the tip is in the nostril, press the plunger firmly to release the dose into the person's nose. Repeat after 2 to 3 minutes. If there is no or minimal response, repeat with second device into the other nostril. To recap this, if there is an overdose suspect, not responsive to painful stimuli, breathing status is slow, less than 10, you're going to use naloxone. If normal enough sound, just turn him on his side. If no or gasping, you're going to still go with the second one. I would like to tell you about the New York Good Samaritan Law. In September 18, 2011, the Good Samaritan Law, it protects individuals who experience an overdose. Individuals who summons EMS call 911 encourage those persons to endorse the right thing and call for help. Protects them from arrest in the presence of misdemeanor possession, and all underage drinking. Prosecution is felony possession. Like this, we have the certificate. Will be issuing certificate for those who attended the class, and we at the same time we are going to issue you a kit that you're going to take. Hope to never use it, but please, if you have to, make sure that you follow our instruction. Thank you and have a pleasant day, and thanks for coming.